Dr. Paul, how you doing?
I'm doing great, buddy. It's good to see you, man. Miss you.
Good to see you too. I got you one of these masks. It's coming in the mail. You're going to see that soon. Not today, Rona. As I understand it, you need an extra mask to cover your N95. So I thought I'd get you a stylish one that made me laugh.
I love it, buddy. That'll keep my mouth nice and protected and hopefully put a smile on my patient's face. Love it.
Hey, that's what we're trying to do. You told me something a couple weeks ago, which was that this is a good time to do something nice for somebody else, just random acts of kindness. And so there you go.
I
You're getting a
appreciate
Rona
it,
mask.
buddy. Yep, everybody's hurting. Spread the love as much as you can.
Yeah, well, I'm really excited to talk to you today and have this conversation for everybody else who's tuning in to check this out, which may only be a handful of people. Who knows? Paul, Dr. Paul here, and I had a few conversations about coronavirus and what's happening, what's going on, what might happen next. And I have personally been having a hard time finding good information about what is happening locally and then again what to expect out there. And so I was sending Dr. Paul here a lot of text messages, a number of phone calls, and he mentioned that a lot of other people were doing the same thing. And so I thought it might be useful to have a conversation and record it just for our local community here and put it up online and see if it's useful to other people. Because if anything else, Paul won't have to take quite as many phone calls with our silly questions. And so what I did to prepare for this was to collect questions from people here in Seal Beach and broader Orange County. I just said, hey, if you could ask a doctor a question right now about COVID, what would it be? And I received a number of interesting questions. They are all over the map, and I have them right here in front of me. And I will just go down the list and read one after another, and then make it as conversational as possible while I weave these questions into it. How does that sound?
Sounds good to me.
Okay. Okay. And then before we get started, I definitely just want to say thank you so much for everything you're doing for everybody out there, being out on the front lines and putting yourself at risk every day out there in the ER. I am certain nobody else realizes this, but I did some back of the napkin calculations the other day, which is that your hospital is in Anaheim and you have the biggest hospital in Anaheim, and Anaheim is the hardest hit spot in Orange County. And so you as a doctor there, you're seeing as much COVID as anybody in Orange County. So I think you're a great authority to speak to on this matter, but more than anything else, just on behalf of me and everybody else that's in our community, we all just want to say thank you and thank you to your family for taking all those risks that you're taking.
It's my pleasure, man. My pleasure.
From the community here, is this thing real? Is it a charade? And I think that's rooted in someone who's been locked down at home and is not seeing what you're seeing out there. And so I'd like you to just tackle that question head on.
Yeah, I mean, I'm getting chills just thinking about it. It's crazy. Is it real? God, yes, it's real. I wish that it wasn't. I mean, this past week was probably the worst week at work I have ever had in my entire life. All of the local nursing homes surrounding my hospital, my ER, have all become infected with COVID. And so those are all the elderly, all of the vulnerable. And so, I work mainly nights. And so every hour I'm getting another phone call, another 911 call saying there's another person coming from one of the local nursing homes that's, not breathing well, that has a fever, that has a cough, that's confused. And by the time they get to me, I have to put them on life support. And it is extremely stressful to be at work right now. Not, I try to protect myself, and I do a very good job. And I wear this full monkey suit, and goggles, and 2 masks, and head protection, and double gloved, and all this stuff. But it's really stressful for my nurses too, who have to be in there and take care of these patients, and they're concerned. And I'm mainly talking about these older people that come in very ill, but I'm still seeing the young, healthy, and normal, the 30, 40, 50 people that come in extremely ill. And I've honestly seen nothing like this. And I feel like I work at a pretty busy ER that gets a lot of sick medical runs. And there's just been nothing like this that I've ever seen in my life. Like dancing with this disease is not something you want to do. So, I mean, yes, it affects the vulnerable, the elderly quite a bit, but we're still seeing it in the young and healthy. It's tough, especially here in Seal Beach, right? So I go out and I'll chat with a friend or two if I see them at the grocery store wearing our masks, and they're like, "Yeah, is this real? Do we need to do this?" I don't know anybody with COVID. I don't know one person. And we've just done a fantastic job here in town and putting the hammer down. So there's like zero, it's not zero cases, there's cases in the teens. And we really decreased that transmission rate, which is fantastic. But it doesn't mean that there aren't areas just outside our little bubble where cases aren't increasing. In Anaheim itself is having tons of cases. And so they're on a trajectory upwards. While we're stagnant and potentially going down, you can't just open Seal Beach, right? Seal Beach, if Seal Beach was an island on its own, we could probably open up, practice our social distancing, wear our masks, the vulnerable try to stay home if they can, and we'd probably be okay. But we're surrounded by Anaheim and Santa Ana that are having these increased rates. And so if we now open up everywhere and become this giant pool again, all these cases are going to go up and we potentially could have a surge.
I do think one big source of anxiety for a lot of people is this idea that no one knows exactly what's going to happen next. No one knows really what to expect. And it's easier to think that there's a conspiracy at play here of one kind or another, or it's not real, because at least then all we would have to do is uncover who's behind it or why it's not real, and we're all in control of our lives again and of the future again. But let's go further into what you said there with the past being a good predictor. Why is the Spanish flu a good indicator of what might happen next?
I think it's a good indicator because both the transmissibility or the infectiousness, sort of like that R value you hear about on the TV at times, and its mortality are both, they're not exact, but they're similar to what we're seeing so far with this COVID breakout. So therefore, it can be extrapolated. Our current situation is extrapolated to the Spanish flu.
So we had, did California overreact in taking some of the same shelter in place measures that New York did, right? Because we've had roughly 3,000 deaths at this point. New York's had north of 21,000 deaths. Seems like two very, very different situations. And what some people wanted to know was, if it's not that bad here, why haven't we reopened sooner, or why aren't we reopening sooner?
It's the $1 million question, right? So New York and California are sort of two different beasts. So it's likely that Corona hit New York very early before they were able to, what we talked about before, the hammer, where you really social isolate, where you stay 6 feet apart, where you wear your masks. They just weren't able to do that in time. And so they got this massive surge. Okay. Us on the West Coast, we're likely able to do it sooner and therefore prevent that initial surge from happening. I think that it very well could have been that LA got hit first and New York got, in a different world, that New York got hit later, and it would just be totally reversed. It just happened to hit there first. Did New York do anything wrong? I don't think so. I think that, I think that we were all given sort of false information coming out of China initially. And so we all, including myself, didn't think that it was that bad. So, at first I was like, I thought we were, maybe all overreacting too, until you really saw it. And so I think that New York probably just reacted a little bit too late, which I don't think is their fault. We were just given false information, and we just happened to react in time and prevent that massive surge. That being said, so now is it time to reopen? So I think a couple things have to happen before we can actually reopen. Two things mainly. One is that we have to see a decline in cases all around, right? So we may be able to, California it's probably going to open up regionally, I would imagine. I don't think it's going to be like all of California is now open, but it will be like Orange County, LA County. But countywide, we need to start seeing a steady decline in cases. And I think it's hard for people in SEAL to understand that because there's been so few cases, right? And there hasn't been this increase. And like I just said, if we were to open up just SEAL Beach in this little bubble, we'd probably be fine. But the problem is we're exposed to all of these other environments where the cases are increasing, and we become one big pool of corona. The surge could increase. The other possibility for opening up faster would be able to test more, right? So once you can actually test everyone, you can then isolate them, and then you can try to do some form of social tracking to see who they've been in contact with and quarantine them. And then all the cases are, they're not going to affect anyone else. And then you could potentially open much, much quicker. But the problem is, our testing right now, people say we're doing an amazing job testing. Well, while people doing these things are much smarter than I, and I don't want to put anyone down, we just aren't. If you look, like this week, so now we can do about 2 million tests a week, right? And so you look at that, that's 8 million tests a month. We have 330 million people in the US. That's only 2.4% of the population we can test. How the heck are you you can't isolate and quarantine and try to track any of that with those numbers. We need much, much more testing. And so until we really have those two things in place, I don't think it's an overreaction.
Because if I'm hearing you right, it's not that the disease is so overwhelmingly deadly in and of itself, but it's that it's so infectious that so many people can get sick at once that's going to drive your deaths up just because of the sheer massive numbers of people getting sick. Plus, when a lot of people get sick, everything becomes more deadly.
Yeah, exactly. The mortality rate is not high. We've all heard it on the news, right? It's between probably 0.5% to 1%. It's probably going to figure out somewhere at the 0.6% range, which isn't horrible. If you look at the seasonal flu, it's usually about 0.1% mortality rate. If you look at like a common cold, it's 0. And also, if you break that number down further, if you look at those that are over 80, if you get the disease, your chance of dying is 13%. That's pretty high. But then that also means that you or I have it's much lower than that 0.6% range, right?
Right.
But yeah, so one of the issues definitely is how infectious it is. And that's the whole reason for flattening out the curve, right? Flattening out the curve is not the reason is not to necessarily prevent death. It's to spread the course of disease over a longer period of time. Therefore, our healthcare providers can not be overwhelmed. because once our healthcare society is overwhelmed or saturated, so let's say that, I know some of the stats are that 5% of people with COVID need ICU beds. So let's say, California undergoes this massive surge. All of our ICU beds are saturated. So all of those people that continue to get COVID that needed ICU care will now die. And all of those people that were trauma patients, bad car accidents, stabbing, shootings, heart attacks, strokes, different types of surgical emergencies. Now all those people die too. So that's really why flattening this curve, staying at home, wearing masks, distancing is so important, because we're not necessarily, because we're not trying to decrease the amount of deaths per se that COVID causes, but we're trying to decrease those preventable deaths, if that makes sense. Because if we flatten it out, then all of those other deaths from heart attacks, strokes, traumas, they can all live now. All those deaths were prevented.
No, and that does make sense, although it's layered in the levels of understanding there. And I think justifiably so. A lot of people here, it's not, the mortality rate isn't that high, and they're confused as to why we're taking such extreme measures. So I think you explaining it like that, step by step, that certainly helps me to understand it much more thoroughly, and why such extreme steps have been taken, and we continue to take those steps.
Yeah, and I mean, don't get me wrong, I don't want to seem like this guy that just wants us to stay home for the next 18 months. Like, I think life needs to go on. I think we need to get back out there. I think we need the economy to, to start to flourish again, because I mean, the longer that we keep the economy down, or the economy starts to hurt, I mean, who does that hurt first, right? It hurts the poor people. And so that's going to lead to inadvertent deaths right there. People aren't going to be able to feed their kids. They're not going to be able to feed themselves. It's going to lead to people being pissed off and killing each other. And so there are death effects, mortality effects on not opening up as well. So that's why we definitely have to find a place in the middle, a dance, if you will, that will allow us to reopen. And I don't think it's going to be this. It's definitely can't be this all or none. It's going to have to be this gradual or graduated type of system where we always have some things implemented, right? We always have, we're always going to wear masks, and we're always going to keep our distance, and we're going to have temperature checkpoints, and we're going to have some travel sort of ban, and we're going to have some limit on social gatherings. The number, who knows? But then after that, hopefully we get to a point where we can start to really start to bring other things in. The young go back to work, the sports open, schools open, and you open these things one by one, and you see how we do. If there's a major spike, we pull back, and if there isn't, we keep on going. And hopefully when we have these little spikes, we'll have enough testing where we can test all these people and say, boom, these are you have it, you need to be isolated. Who did you come into contact with? You test them, you quarantine them, and then all of a sudden this becomes a much easier process.
Yeah, I like that idea of what you said there. I mean, that we have to figure out how to live with this thing. So it starts with, yes, it's real. Yes, it's a thing that's happening to us, and we have to figure out ways to deal with it, which starts with the steps we've taken. And now we need to figure out how to live with it, because it's not just necessarily the economy that we're talking about here. I mean, I think a lot of the time when people say economy, other people hear, oh, stock market portfolios and housing prices. But what we're really talking about is society. I mean, we need there to be a society to come back to. And if we stay, like you said, if this thing is going to be around for 18 months, there wouldn't be a society to come back to if we were to just hunker down and stop living for all of that time.
No, 100%. And I think that we need to stop thinking of it as, you know, healthcare versus economy, and maybe thinking of it more as just overall survival.
Yeah.
I think that may be a better way to come at it, because that incorporates both, and you have to incorporate both, right? There has to be a way in the middle where we're not completely shut down, but that we're able to go out, but massive people aren't dying, and we're able to prevent those deaths that could be happening. There has to be somewhere in the middle. And it's going to take some time to find, I think, to find that equilibrium. And what's going to be, tough is that that equilibrium is always going to be changing. It's always going to be up and down. We're going to be dancing with this thing. Sometimes we're going to be able to have sport. Sometimes we're not. Sometimes the young and non-vulnerable can go back to work. And sometimes we'll have to pull that back. It's going to have to be fluid.
Yeah. So, well, a couple of things on that. The CDC, I believe, was the one that released this data, but they were now thinking that there could be an additional 75,000 deaths of despair in the United States as a result of the lockdown measures and then the subsequent unemployment, and deaths of despair being the drug overdoses, death by drinking yourself to death, and suicide. And so I think what that illustrates and what you're getting at there is that any of these steps we take have consequences in terms of lives lost, and figuring out that balance of, I like what you just said about how it's really about survival. I mean, how do we help the most number of people stay healthy and thrive? Talk to me about, just in more detail, about what the dance looks like, as because what I'm hearing from you is we have a lot more than the A option or the B option, which is totally locked down or totally opened up, right? There's all this room in the middle, and that's what really everybody's trying to figure out right now. And so, is this a situation where we would kind of slowly ramp up at, we're 20% of what we used to do, 30%, 40%, all the way up to 90, and hopefully, and then at some point at 100? Or is this more of a situation where we move up to 40%, back down to 20%, up to 60%, back down to 50%, and then it depends on where you are and different pockets of the country, and are there flare-ups with the disease there? What type of scenario did you envision? And I know we can't predict the future, but as a likely outcome of what we're looking at over the next 18 months.
Yeah, so I mean, like I was saying before, I think that there's always going to have to be certain things that are in place. Okay, so we get all those things in place, the social distancing, mask, temperature check points, restrictions on travel, social gatherings to a certain number, and then you are hopefully in an area where we are on a downcline of cases.
Okay.
And then you open up something slowly. So what some places are doing now, they're starting to open up movie theaters and some shops. Okay. And then what you have to do then is that you wait for 14 days, because that's the incubation period, meaning the time that you come into contact with someone that was ill to when you may actually be showing symptoms. 14 days is a little bit, it's a very conservative estimate. Most people say it's around 5, but we use 14 just to be safe. Okay. So the way I see it is that we just do this gradual approach where we open little by little, waiting 14 days between each gradual opening. And if you continue to see decline, then you can continue to reopen. And it would be my hope, and it's going to be difficult, but it would be my hope that it's not this 100%, 0%, 90%, 10%. That's going to drive people crazy, right?
Right.
It's going to have to be much, much more delicate than that, I think, for people to feel good about it. and for people to feel like their lives aren't being taken away. And so hopefully we can strike that delicate balance of dancing and opening up and closing just a little bit, and then opening up just a little bit and closing just a little bit if we need to. Not this all or none, not this 90-10, because I don't think that's good for anybody. It's not good for the
Right.
economy. It's not good for mental health. It's not good. It's just not a good situation. So I think while it's going to be it's going to take a lot more effort to do it that way. I mean, I would hope that that's the approach that, the higher ups take.
Yeah. Yeah. Now, one of the other questions that was put to me on this, how are cases being counted? Because something that seems like an inherent problem in counting the cases and tracking if they're going up or down is if we're testing more, wouldn't we just naturally see more cases, be counting more cases? And then tied to that, which I'm sure you're going to have some insights into, is how are the deaths being counted in hospitals? Because I had someone ask me, they said, well, I've heard that if you go in and you have a heart attack right now and die from it, that they're just counting that as a COVID death. And I said, that doesn't sound right to me, but I can't prove it to you. And so I'd like you to just talk about that whole thing. I mean, how do they account for we're doing more testing and not just increasing the case count by doing more testing? And then how are the deaths being calculated in the hospital so that they know who actually died from a COVID death and who hasn't?
Yeah, so I mean, testing it's a massive, massive issue. It's something I have trouble with honestly every day. Right now, I'm pretty much only able to test people at long-term care facilities, people that are admitted to the hospital, or a healthcare worker that is symptomatic. And then where does that leave everyone else? There are 5 to 10 people a shift that are our age or younger coming in with these COVID type symptoms. I tell them they're COVID positive. I tell them to self-isolate. I encourage them to go to a testing center so maybe it'll get documented. Do they? Probably not. Are the case numbers much higher than we think? 100%. And that's part of the problem. Without testing, we don't really know where we are. And the whole testing numbers, I mean, I read this article the other day. It's that you don't really know that you're testing enough until your test positivity rate is only 3%. And what's crazy right now is we're only testing people we know are positive, right? And so I bet our testing rate is 90%. So we
Mm.
are so far from
Oh.
from having the amount of testing that we need.
And let me make sure I understand what you mean by that. So you're saying that we need to get to a point where we would be testing so many people that only 3% of the tests would come back positive.
Positive. That's how
That
you
means
know
we're
you're
testing
testing enough.
enough. Wow. And we are at currently 90% of the time.
I
Yeah.
have nothing to back that up. I just made
Right.
that number up. But from my experience, seeing people go into the
Yeah.
hospital, checking on previous patients to see if they did indeed have COVID, I would say about 90%. But
Sure. But the people
that's
you're testing are very, very sick.
exactly.
And point being, we're a really long ways from getting to a 3% number.
We're really far away. And I mean, my hospital is a little bit different, so I can't speak for everyone. We call the CDC to get the tests. There are, university centers, Irvine, SC, LA, that I'm sure, and I've heard, on podcasts and things that they're testing much, much more. So I'm
Mm.
not saying this is the way it is globally. I'm just saying for a small community hospital, it's the way it is. And we're probably going to be the last one to get all the tests to be able to test everyone, but it's just not here yet. And I know initially, so going to the deaths, I mean, initially, yes, I know like in December and January, people would come in with heart attacks, and they attribute it to just to a, to an MI and to a heart attack, and that was the cause of death. Now there's been a lot of retrospective analysis going back, taking a look at these heart attacks and strokes and things to see if this was indeed the first presenting symptom of COVID. So one of the things that, I don't know how much is really talked, I haven't heard it talked about much on mainstream news, is that it really does, it causes this, COVID causes this massive inflammatory response, which leads down the road to basically your blood clotting a lot easier. And so that's why the thought is that, it's not the thought, there are a lot more strokes and there are a lot more heart attacks in COVID positive patients due to the massive inflammation that's going on. So there definitely is, retrospective analysis going back and looking, and I think that people that are dying now from those things, if they aren't tested when they're admitted, they're probably tested, when they pass.
Okay, so, and it's not that numbers are being inflated to claim COVID deaths when they aren't actually COVID deaths. It's that there's a retrospective analysis of previous deaths and going, oh, it was actually here before we knew what it was.
Exactly.
And that's increasing the death count.
Yeah, because
there.
we when this all initially came out, it was, fever, cough, sore throat, and that was it. And now we're learning, it's much, much more complicated than that. You can get stroke or neurologic symptoms. You can get chest pain and heart attacks. You can get weird, skin or dermatologic findings that are pathognomonic for it. So it's affecting every system a little bit differently. And, initially we were just thinking that was a typical stroke or a typical heart attack. But looking back, we're like, no, that's probably caused because of the massive inflammation from COVID, especially when you have a 35-year-old healthy guy coming in with a massive heart attack or, a stroke that leaves them completely paralyzed, which is very atypical.
Well, and I thought this was just interesting in terms of the psychology of what people are dealing with right now. So in addition to those questions, a few people had asked, are deaths being inflated? There were also questions, are deaths being undercounted? Because, and someone tipped me off to this, they sent me the link that was just showing overall mortality rates in the last 2 months versus the same 2 months the year before, the same 2 months the year before, and just overall mortality is up, whether that's in LA County, California as a whole, New York, and then a number of cities throughout Europe. It was a clear trend. And so those numbers were indicating that if COVID is the number one variable that is different this year versus the last 5 years, that perhaps those deaths are being undercounted because there's no other reason to explain a huge rise in stroke, heart attack, lung disease, cancer, and whatnot.
But there is another reason.
Mm.
So the reason is that no one is coming to the ER. Everybody is scared. If you look at our census is back up now, but a month ago we were seeing half the total patients that we would typically see, right? And all that we were seeing were these bogus, mild COVID patients that were, 18 to 30. They were all going to be fine, right?
Okay.
So where did all the heart attacks go? Where did all the strokes go? Where did the surgical emergencies go? Where did all these things go? They didn't stop happening. What happened is that they were so scared to come into the ER, they stayed home. And unfortunately, a lot of them passed away at home. So is it COVID related? Yes, but it's not from COVID.
Right.
So finally, our ER is starting to come back to normal. I'm starting to see trauma patients. Saw a nice screwdriver stabbing to the back the other day. We're seeing I saw a pretty sick heart attack the other night, and I haven't seen any strokes recently, but so regular bread and butter emergency medicine is starting to come back. And then now that that's happening, you might see those sort of death rates decline some now that we can actually give them the type of care that they need, that they deserve. And so, and I think that's a big point that needs to be made. I mean, initially there was this massive push. It was just, if you're sick, stay home, stay home. And so everybody was just staying home. And people did
Right.
a great job. They were dying and staying home. And now we have to get the message out that if you're sick, it's okay to come in and we can protect you. We separate our patients. We have, patients that we are worried about COVID are in a certain area. They're in, closed doors. We take special precautions, and you would be in a, in a totally different room, a totally different area. So hopefully that message starts to get back out that, if you're not doing well, come in. We can still care for you and keep you safe of COVID.
That's great. Yeah, I think that is an important message. There was someone who emailed me recently and asked me to ask you if it was a woman who's 9 months pregnant, is it safe for her to go to the hospital to have her baby?
I think it is. I mean, especially in the labor and delivery area, they are taking, massive precautions, and everyone is in full PPE, and they're keeping their distance, and they're sterilizing everything because they understand how critical it is to keep both mother and then baby, safe.
Sweden. There's been a lot of talk about Sweden. Why can't California just do what Sweden is doing? Or is that what we're actually just trying to slowly move up towards as we gradually loosen the lockdown and see what happens one step at a time?
Yeah, I mean, Sweden and the US are just two totally different beasts. And I don't, it's very, very hard to compare the two, right? I mean, that's maybe a good way to look at it, that we are sort of easing our way towards where Sweden is, potentially. Which way is better? We're not going to know until this whole thing is over, right? And so early on, if you look at per capita deaths, Sweden, they weren't doing complete social distancing. They were keeping the vulnerable home. Kids were still at school, and their per capita deaths were lower than ours, right? And people were like, "Whoa, what's going on? Why can't we be out and about?" And then now all of a sudden they're starting to have a spike. So now their per capita deaths are higher than ours. So now they're having a spike, and on the percentage per population, they're doing worse. And this is really a marathon, and it's not a sprint. So just because they were doing better initially, if this was a 100-meter sprint and they were doing well and they were ahead for the first 50 meters, you could be like, yeah, they're probably going to win, and that was probably the better way to do it. But now that they're doing a little bit worse, we're going to have to really see where we are, in that marathon. We're going to have to see where we are in that 24th, 25th mile, and then that'll let us know which way was the best. I don't think we could do what Sweden did. We're just too different. But I don't know which way is better, and I don't think that we will know until the very end, until it's all been said and done.
Talk a little bit about viral load and what that means.
Well, viral load is basically, how much virus you have going on in your body at this present time. And so there's this thought about, there's sort of different waves in this illness. There's this incubation, or like this pre-symptomatic period, where the viral load may not be that high, but that's when we actually think that the transmission of disease may be the worst, because you have no idea that you're infected, but you're spreading the disease. Then you actually get symptoms after the incubation period, and then your viral load is definitely the highest. But hopefully at that time, we're self-isolating, so we're not going to be spreading it that much.
Yeah.
And then you talk about viral load sort of in the environment, or just in the air, or on the surface. And that's where people are getting, just a little bit of virus can be picked up, and you can get the disease from that. And then there's the asymptomatic, such as our kids, if they potentially could be carriers. And if you're asymptomatic, your viral load is going to be much, much, much less. So you're just not going to be spreading that much disease. And so I think because of that, I think the more that we're learning, kids should be definitely going back to school in August, because I think that even though they may carry the disease, their viral load is going to be much, much lower. And so bringing these kids, these kids go to school, maybe they catch COVID, they're asymptomatic, they bring it home. I don't think they're going to be having a virus to really affect you or I as parents. Would it be a good idea for grandparents to be living with kids in a time like this when kids go back to school? Probably not. But for you or I don't think it poses much as a problem.
So if I'm understanding correctly, the more sick that an individual is, the higher their viral load might be in terms of giving it to somebody else.
100%, yes.
Okay, and does that have a big role to play in why healthcare workers have become, the way I understand it, sick more often and more severe than your average population based on age group and other demographics?
For healthcare workers, yes, and also, there's probably slight variation in these strains. If you think about it, and so the healthcare workers are exposed to the worst of the worst. That's what brings people to a hospital. So, when I'm putting someone on life support, that person is obviously very, very ill, and so I'm being exposed to the worst, strain of COVID out there. So if I happen to contract it, am I going to get sick? You betcha.
What does youth sports possibly look like in light of all this?
I think hopefully youth sports will be one of the first things that come back, honestly. There's been optimism in the Seal Beach community that baseball is going to come back in June. I don't know how realistic that is, and I hope to God we can do it, because I miss baseball probably more than my son. But I think in the fall, it's a real possibility. And I think that we've talked about before that kids sports, they're these kids may be carriers, but they're asymptomatic. The viral load's going to be low. I think that is I think that's one of the first things that could potentially come back. Will it be June? Probably not.
Grandparents won't be attending soccer games and baseball games.
I don't think so. I think the vulnerable need to stay home until this thing, if you're older than 65, if you have heart or lung disease, if you're diabetes, or if your BMI is greater than 40, I think you need to stay home until we figure this out. We all just need to realize too that this is affecting everybody in different ways, and everybody's hurting. Everyone is. Everyone's going through a hard time, and I don't know. It's a pretty awesome time to do something good for somebody. Everyone's hurting, so spread the love. Be as positive and as loving as you can, because everyone's hurting.
There were a ton of people that just sent comments that just said, I just want to say thank you. Though any of these doctors or nurses, they're real life heroes today. And I think 9/11 made it clear for a lot of people the dangers of being a police officer, of being a fireman. And one silver lining with this, I think people that work in ERs have always on one level or another put themselves on the line as part of their daily job. And a lot of people, and rarely do we take the time to think about that. And this is, and you're really putting yourselves into some dangerous situations now. And so I just one more time, thank you for your service and for your sacrifices. It means a lot to all of us.
Well, thank you very much, my friend. It's definitely our pleasure. I love doing it, and spread the love, stay positive.
All right. How do I turn this thing off?